What was your vision for UHS in 1979?
Well, I was looking to do something meaningful with my life. And I thought this is a very meaningful thing to do for the rest of your life. Helping people, making a difference. I thought that was good life's work. And so that's what I was interested in. Well, I had no idea how big the company would be. I just wanted to make sure that we were going to take care of patients in a way that I would want my family taken care of.
The doctors, they saved my life.
Being here saved my life.
Providing superior quality care is our #1 mission.
We do patients first and second and third.
All these rules and laws and regulations that I spend my time in and my staff spends its time in looking at and making sure we're complying really break down to making sure providers are putting the patients first. And that's something that UHS definitely does.
Every decision is made with the patient's well-being first and foremost.
The company embarked on our Service Excellence Initiative probably more than 20 years ago, and today the program is extremely sophisticated. It's really become part of our DNA, that delivering quality service to our patients and to our customers is so much on the forefront of everybody's mind that it's become second nature to hopefully all of our employees.
We value the people that we work with, and we are inspired by them every day.
The people at UHS have always been special. So when you look at any great company, and I think a 40-year history and long successful history certainly qualifies UHS as that, it all starts with the people.
I came to the company in January 1, 1979, one of UHS's first employees. It was very exhilarating. We grew as a team.
We started out with 6 people, and now we are over 87,000 strong. And the good thing about that is that all of those people are in some way helping other people, which is a wonderful thing.
As I say to our employees, we have 4 walls. It all depends on what we put inside those 4 walls, and you have to have the best employees or you have nothing. And I think that is the key to promoting great healthcare to your community.
We are represented by a body of people, and a body of people who care about patients, who deliver excellent care. And I've witnessed patients tell our staff, if it weren't for you, I might not be alive today.
UHS values employees, I think, primarily by providing the training and the support that we give them so that they can be the best. And when we have the best employees, we have the best care and we have the best outcomes.
Integrity to me is doing the right thing at the right time for the right reason every single time. Part of the reason that I've stayed at UHS for 36 years is because UHS is a company of high integrity.
Integrity. The word that I think about to describe UHS is doing the right thing when nobody's looking, meaning that we're going to provide the best care regardless of any distraction.
UHS has done a terrific job of trying to do the best it can do, be the best it can be, but most importantly, do it in a way that it's fair and honest.
I think UHS's leadership position in the healthcare space continues to raise the bar for all healthcare providers.
The Las Vegas shootings, getting information about it and hearing about it, and all the patients that came to the Valley Health System hospitals that were treated. I had such incredible pride at what our hospitals had done. Everybody I heard about, people who weren't working, came in to lend a hand. They didn't get paid more, but the most important thing was there were hundreds of people brought to our hospital, and we didn't ask one of them if they had insurance. We didn't ask one of them if they could pay. We just treated them because it's what we did.
The world is paying a lot more attention to the healthcare industry. There's a lot of pressure on the industry right now, and I think maintaining your integrity is the only way to survive in the future.
We are an integral part of every community and very, very important, and they view us as such, and they like us.
UHS has always believed that healthcare is a local business and has, over the years, given the hospital CEOs the autonomy to really operate the hospital as part of the community.
Our core mission has been to get into communities and stay there. We have great longevity in most of the communities that we serve, and I think that's vastly different than some of our competitors who have been in and out of markets. So we're able to make a long-lasting impact, really get to know the community, and be a great corporate citizen in so many communities around the country.
So as we engage with the community, part of our responsibility is making sure that they remain healthy. So we've done a significant number of health screenings, and those efforts are really helping identify health issues that may have gone unnoticed and helping those patients get care so that they're not getting critically ill.
I decided to accept a position on the UHS Board of Directors for 2 reasons. 1, their patient-first mentality, and 2, their unwavering commitment to veterans.
These are people that have protected us to the detriment of their own health. They protected us, and we are helping them, which is rightfully so. We help a lot, and I'm very proud of what we've done.
First off, we take pride in the military. And I'll just say this, it's leadership. Everyone that works on that program is either a veteran themselves or been in a military family, and that's one of the things that makes it special.
I am so proud of what we do in our local communities. We serve domestic violence shelters, we work with NAMI, we work with other professional organizations, we work with different suicide alliances. And when we do that, we are helping the health and wellness of our community. And our communities look at us as resources, and that's always a good feeling.
We're not put together as a company to be sold. That's why we're sitting here in our 40th year.
I chose to join this company for 2 reasons. My first reason was I was struck by UHS's strategy. They seem to balance profitability and social conscience and understand that a benevolent company will actually lead to significant long-term value for all stakeholders.
I think the future is very bright, obviously. I think that our core mission has held throughout the first 40 years. And I think for the next 40 years, it's doubling down on a lot of the things that we've already done, but recognizing that healthcare has changed and is changing so much, and being adaptive and being ready to capitalize on those changes. We've done that before. We have been ahead of the curve in a lot of ways. And I think that focusing on technological advances, we've put a lot of time and effort into technology, into information systems. We try to do it a little bit differently than a lot of others do. And building upon that in the future, I think will help us to be even more successful. So not always doing things the way everyone else in the industry is doing them. And I think that's very consistent with our overall theme, which is we're the only company with the 2 divisions the way we are. And we've always kind of bucked trends a little bit, and I think continuing that will make us successful well into the future.